Behavioral therapies are targeted to rectifying the faulty learning pattern or the maladaptive behaviors. Now, there is not one unified method that fits all. There are various strategies which are adopted under behavioral therapy in order to rectify the faulty learning, the faulty behavior, and the maladaptive behavior. Now, also important to note, these behavioral therapies work very differently. For a person who is anxious versus a person who is highly depressed, the kind of therapies and the process, the modality would vary. So, as mentioned, there is no one strategy that fits all. There is no one therapy that can be uniformly applied to all, and the therapies also vary based on the intensity of the mental disorder. So let's understand the behavioral therapy, the basis of it. Now, to start with, I have a very simple example of a person who is smoking. Now, the person who says that I am there to smoke says that I know this is a maladaptive behavior. 90% of the population around me does not smoke, but I do smoke. So, first thing that is identified is the maladaptive behavior. So, once the maladaptive behavior is identified, what is the next step? The next step is the factor. So it could be an antecedent factor. Antecedent factors are the factors that precede the behavior. So when a person says that I am smoking, what is the thing that precedes that behavior? Probably it could be stress. So here stress acts as an antecedent factor to smoking. So as a therapist, your role is to identify why the person is smoking. Now, we identified that stress is the reason why the person is smoking. So, antecedent factor is a factor, I repeat, which predisposes a person to involve into a certain behavior. And stress, whenever this person does not smoke regularly, but whenever the person is in stress, the person would start to smoke. So this is a antecedent factor. The next is a maintaining factor. Maintaining factor is a factor that leads to persistence in the faulty behavior. So this behavior would linger on and on. So when I say this behavior lingers on and on or goes continuously, we call this as a maintaining factor. So by interviewing the person, interviewing the close family members of the person, we can do the annual examination of that client and understand when this person smokes, what are the factors that lead to smoking for that person, and finally what are the feelings that person gets involved with and that acts as a maintaining factor. So once the person is in stress, the person starts to smoke, and then after the person starts to smoke, what are the factors that continue to force him to smoke? So those are the maintaining factors which always reinforce the person to get a relief from the anxiety which is caused. So there is understanding of the antecedent and the consequent operations. I have a very simple example. Let's say a child is there. Now when the child is at the homework, the child says I am hungry. The child eats a lot of food, but what happens at a dinner time? At the dinner time, the child rejects, I don't want to eat anything. Now, as a mother, what you can do? There could be two ways to approach it. First is an antecedent operation, the next is a consequent operation. The antecedent operation is pretty simple. You cut down the amount of intake of the food at the time of tea. Probably the child would get hungry and consume more in the dinner. So this is an antecedent. This is something prior. So you reduce the food at the time of the tea, and therefore the child would remain hungry and would consume more at the dinner time. This is an antecedent operation. What could be a consequent operation? Consequent is something that happens after. Let's say a child takes the diet normally during the dinner time. Rather than leaving it as such, you simply praise the child. And this is a consequent operation. The child would be happy about it, and when the child would be happy around it, probably this would become a habit next time. And this is what is a consequent operation. Clear? So two operations that are very important in behavioral therapy is the antecedent operation, which is prior to the things that you manipulate prior to the consequence. Consequent operation is as a result of the consequence. So once done, you are trying to bring that into practice. Both of these methods, be it the antecedent or the consequent, would slowly remove the faulty behavior and create a more adaptive behavior. Now, as I previously mentioned, behavioral therapy is not just a one sock that fits all. It is a series of techniques that can be involved. And here is the list. Of these, the most important ones that we focus are the negative reinforcement and the aversive conditioning. Two of these are very important. All of these techniques are directed to change the behavior of an individual, to make a maladaptive behavior, or to convert, I can say, a maladaptive behavior into an adaptive behavior. This could be through reinforcement techniques. This could be through operant conditioning methods, as we have studied in learning. So, let's understand these techniques one by one. The first technique is a technique of negative reinforcement. Negative reinforcement simply means you try to move away from a dangerous stimulus. As simple as that. And this is what is negative reinforcement. Simply meaning that if there is an extreme cold weather situation, you simply try to keep yourself away from that situation. So what you can do is, you can buy an electric heater, you can have a big jacket over you, and that is how negative reinforcement works. So negative reinforcement, simply put, helps you to move away from the dangerous stimuli and help in creating a behavioral modification. And this is a negative reinforcement. The next is aversive conditioning. Aversive conditioning is something you want to keep away from. For example, a person consumes alcohol. So, you want that this person should quit alcohol. What you can do is, give a person a mild shock and then ask him to smell the alcohol. Do it for 3 or 4 or 5 times. The 6th time, the person would say, oh, this is something which is not good. The smell is obnoxious. I should leave alcohol. Okay, so this is a kind of aversive conditioning. A repeated association to an undesired response. And the undesired response in this case was an electric shock. So you are repeatedly asking a person to smell the alcohol and give a shock. Smell alcohol and give a shock. That means it creates an undesired pairing. And since this pairing is undesired, there would be aversion. The person would try to move away from the issue. And this is one type of behavioral therapy. The next type of behavioral therapy is very simple, which is positive reinforcement. Child does a homework, mother prepares something special in the dinner. A very simple example of positive reinforcement. Also, sometimes with the positive reinforcement, we say token economy works. Token as a symbol of reward. Now, this token could be anything. This could be a simple rubber, a simple pencil, and this token actually motivates the child to complete the homework. And this is what is known as token economy. So either a positive reinforcement, which could be a special food or the favorite food that the child likes to be prepared if the child completes the homework on time, or just to give him a small token of reward that the child is fond of. Necessarily not the reward should be expensive or difficult to procure, but a small token that could actually create a positive momentum. And this is part of positive reinforcement. So, understand, we have understood how negative reinforcement works, how positive reinforcement works, how aversive conditioning works, and token economy works. The next is further interesting. The next we say is differential reinforcement. Now what is differential reinforcement? Differential reinforcement is understanding what things could be reinforced and what things the wanted behavior should be increased and the unwanted behavior should be reduced. So a very simple example here again. There is a small child who goes to a toy shop. There the child wants to have certain toys. Now the child cries and cries and cries and asks the parents to get the toys. The parent does not want to motivate this kind of behavior. So, what they would do is, they would not get the toy. The next day, what happens is, the same child, again with the parent, goes to the toy shop. Rather than creating a big scene in the toy shop, crying and crying aloud, the child simply requests that I am liking this toy, if possible, can I get this toy? The parents get very happy and get the toy for the child. Now, this is a process of differential reinforcement where the child now understands that if I am crying, that behavior is unwanted, it should be reduced. If I am requesting politely, this behavior is good and it should be motivated. So, this is how differential reinforcement works, and the behavior which is wanted is given a push. However, the unwanted behavior is given a decline, we could say. So, this is very practical way of doing behavioral therapies. The next important method is systematic desensitization. Now, this method was brought by Wulp. Wulp basically said that whenever there is a fear-provoking situation, a situation where the fear level increases, in those scenarios, systematic desensitization works well. How? We have a very simple example here. The child here is afraid of dog, and every time the child sees a dog, the child either tries to run away, fear, or create a panic situation. Now, how can a systematic desensitization work? The very simple way here is, let's say you are there as a therapist with a child. So, you can yourself go very close to the dog and explain that the dog did not did any harm to you. The child would see you and probably try to imitate. And slowly and gradually, the fear which was there or the fear-provoking instance would reduce. So now this works by two ways. One is the person or the therapist would try to do this as a role figure, and that thing would be imitated by the client. The second thing is the person, the client, would be slowly introduced to it. Rather than having a very wild scene where a dog is running behind the person like anything, we could have a systematic desensitization where the person is slowly brought closer to the dog, the distance is slowly reduced, and this is the process of systematic desensitization. There could be a scene where therapist could provide food to the dog, and this would help the client also at least try, if not provide food, go closer to the dog. And this is how systematic desensitization works. So it is systematic as the name suggests, and desensitization, that means the issue with which you are sensitive slowly gets desensitized. It's no more sensitive for you. Also, This follows the principle of reciprocal inhibition. The reciprocal inhibition principle simply explains that there are two mutually opposing forces that are working on the same time. So, what you need to do is you need to inhibit the weaker force. And once this is done, the relaxation response automatically moves in. So, principle of reciprocal inhibition. I repeat again, reciprocal inhibition says that there are two mutually opposing forces which are working on the same time. The weaker force needs to be inhibited, and therefore the opposite force would automatically gain momentum, and there would be more relaxation that can be provided in a fear-provoking instances, which can in long run reduce the levels of anxiety. The next is modeling. Modeling is a common way. A person wants to become something like the role model. So let's say a child here wants to become like Abraham Lincoln. So the therapist who either themselves can act as a role model or can explain how their role model used to do. So those are the things through which learning can be strengthened, and behavior, a maladaptive behavior, can be rectified. So you can explain, okay, this is your role model and he does this, he or she does this. So you can also do the things in the following manner. The next important way is vicarious learning. Vicarious learning is nothing but simply learning by seeing others, and that's how a child grows in a school. A child, when on the first day is asked to climb up the slide and move down the slide, probably 5 of the 10 children may be afraid, but the other 5 who move down the slide, the 5 children who are afraid would see them and try to take a step forward and enjoy the slide later. So that is what is vicarious learning. Vicarious learning is simply learning by observing others, and in this process small changes are there or small rewards are there which change your behavior. So this is an excellent way of bringing in behavioral changes. So in this section, we have understood how various behavioral therapies work and the various examples which you can understand the therapies with.